Good morning. We're back on the Mountain Morning Show. We're talking about the People's Health Clinic as we talk about them every 2 weeks, and we have different doctors come on over. Today we've got a pharmacist in studio with us. It's Katherine Smith, and we're happy to have her in here. Katherine, how you doing?
Pretty good, thanks.
Good, and I've got to tell you how incredibly successful the 10-year anniversary party was on Monday night. I was happy to see the people that went out to actually support the People's Health Clinic, and not only that though, but I think there's a huge pullback to you guys for how much support you give the clinic, the doctors and the founders, and how much money and time and effort you really put into it. I mean, I have this huge gain success for, or appreciation, I should say, for the clinic, even more so than I did. So thanks to you and everybody else for all you guys do. But let's talk about, you know, I always like to highlight how many different doctors there are that come on. I think that's what shocked me and probably shocks some of our viewers as well, that there's a plethora of people, and you're just one of them over there.
Just one pharmacist. I enjoy working with many physicians, midwives, pediatricians, you name it.
Yeah, and so let's talk about what it is you do specifically at the health clinic.
I'm kind of just getting started, really. I've been working with them trying to figure out ways to get less expensive medications for patients through patient assistance programs. Sometimes there's some discounts the clinic can buy, like bulk medications, and they have a place to store it, and trying to figure out how to get it out to the patients. Also, just helping the prescribers find the best and least expensive medications as well.
That's always a hard part of going to see the doctor. You want to find out if something is wrong, but then if there is, you have all these medications that you need to buy and you're expected to buy, and it gets really expensive if you don't have the proper insurance.
Correct.
Which you guys do for the uninsured at People's Health Clinic to help these people out with their doctor visits, with their medications. Is it hard to try and find these ways to get the medication costs down?
Definitely. I mean, I think we're very limited in a lot of ways by, you know, what's available as a generic, or which patient assistance programs are offered, and that involves usually a lot of paperwork, maybe even a long lag time. May take several weeks to get the medication for the patient, so it's definitely a challenge.
Do you find that people know that you're there at the health clinic, or is it more something when they go to the doctor and then are told that they need to get these medications, then they're presented to you?
Yeah, I'm definitely more, at this point, a behind-the-scenes kind of person, I would say. I'm often answering questions from the prescribers or providers. And, but, you know, if a question comes up and, you know, the patient says, I don't really understand, is this drug okay to use? They say, hey, you know, can you go talk to this patient? I'm happy to do that.
Absolutely. And the clinic, for those of you who aren't aware, just recently opened in a beautiful, beautiful new building. And it's seeing a lot more patients, which is good and bad. It's kind of that good that we're helping out, but bad that there's so many people that are uninsured that actually need to use it. But great that we do have the facility for people to actually go to and meet people like you know, that are able to help them and give them their prescriptions. And you're there just once a week or so.
Yep, half day a week.
And when they come on over, I'm sure you, along with everybody else, all the doctors, they're so nice when they come in. And a lot of it, I think, goes off of that they're doing this on a volunteer basis, you know, and so they're there because they want to be. And they've had years and years in the practice, and now they're really trying to devote their time to something they feel very strong about.
Definitely.
Yeah.
Definitely.
Well, Katherine, we're so thankful that you came in. Thank you again to People's Health Clinic. Make sure to tell them that I was so extremely pleased with how the party went, and we're actually going to show you the winner of the cake competition.
Yeah.
We've got her here. But how do they get a hold of you or the clinic in general with the website?
Let's see, the website.
peopleshealthclinic.org.
Yes.
There you go.
Yeah.
I'll save you. So it's just easy website. Go on there. You'll be able to find the clinic. And you can head on over. Tons of doctors. You'll be able to see the different things that they do provide, as well as the pharmacist. So, Katherine, thanks so much.
Thank you.